Hello, everyone. Thank you so much for joining us for our third CSI Squared talk. Today, we are going to hear from Dr. Noreen Khan. She is a glaucoma and cataract surgeon and partner at the Northern Virginia Ophthalmology Associates. She is the director of clinical research and part of the AGS Finance Committee. She is going to talk to us about a topic that many of us here today have experienced personally but rarely discussed publicly. Thank you, Dr. Khan, for sharing your story.
Thank you. I have no relevant financial disclosures for this talk. Let me tell you about my favorite part of my infertility journey. I was going through in vitro fertilization, also known as IVF. I was at month 3, and I'm following a hormone injection schedule so meticulous. The stakes are high. If you miss one dose or even overshoot the schedule for more than 2 hours, it's bye-bye, baby. I'd lose that 10K I spent getting to this point, and I'd have to start the IVF process all over again. So now, it's a Tuesday night, and I'm coming home for my 6 p.m. sharp injection, and my husband and I are having this exact conversation. Hey, honey, do you know where I put that box of hormone medications over there? Did you see it? I left it by the chair. Nah, you must have put it somewhere else. There were a bunch of Amazon boxes. I tossed those in the dumpster. No. Hold on. What did you say? You ordered all this stuff from Amazon. The boxes were piling up. I tossed them in the dumpster. You're welcome. I lost it in stages. First, the sobbing. The deep, catch your breath, sobbing tears. Then, mega bridezilla, which is basically regular bridezilla, but I was fat from all the hormones I had been injecting for the past 3 months. And let me tell you, fat bridezilla is way worse than regular bridezilla. She doesn't just hate you, she hates herself. And someone's to blame, and in this case, it was my husband. He had thrown out my box of hormone medications. I was furious. But luckily, my doctor husband, bless him, he immediately rose to the occasion. He took those expertly trained hands that he himself had spent $250,000 for his own medical training to fine-tune into precision life-saving instruments, and he plunged into that dumpster, and he clawed his way for an hour through the hot garbage. And luckily, he rose from the stink as my night in seafoam scrubs, he found those hormone injections. Ultimately, we did get pregnant, but only after a series of traumatic incidents like this. And here's the thing. No one at work knew what I was going through. I didn't feel like I could talk about it, and in many cases, I know my female colleagues feel like they can't discuss it either. So why am I talking about this at an ophthalmology conference? Because regardless of where you work, at least one of your female colleagues is struggling with a temporary period in her life that makes her behave in an unusual way that can sabotage her career or cause friction with her staff and her patients if she doesn't feel comfortable telling you that she's going through IVF. 1 in 5 women in the general population goes through fertility issues. But statistically, in this room, 1 in 3 young women surgeons will go through infertility treatment at some point. And practices have an opportunity to breed greater loyalty from this top female talent by making just a small change in openly letting their young female hires know that the practice will support them during this time of medical uncertainty. For me, telling my practice and my patients about what I was going through led to a greater understanding and empathy from them when I needed it most. It bonded me to my practice and my patients in a way that I really wasn't expecting. So I'm hoping that all of you in this room who are definitely working with someone who is going through this will encourage them to do the same and help build a culture where they feel comfortable doing so. So let's go back through the IVF process and why do women have a hard time disclosing? The IVF process involves lots of daily hormone injections, taking suppositories, daily blood draws before your own clinic, embracing an unpredictable calendar, growing your walnut-sized ovaries into grapefruit-sized ovaries, sleepless nights, dropping your hormone needle in a dirty restaurant bathroom, injecting yourself with that needle anyway, full-scale emotional breakdown, pouring your feelings out to your gardener, John Paul, wondering why I'm confiding in a person with 2 first names, having your tech tell you, I just look at my husband and we get pregnant, wondering how to drastically increase her patient load. The first problem I had was that my practice didn't know. And us ophthalmologists, we train at an elite level. Our standard in residency is to never call out, never admit that we're less than capable of. We don't even take post-call days. So I initially didn't tell my practice about my IVF because I kept thinking, 1, I don't want people to know about my personal business. I have no idea if or when this was going to be successful. And if someone kept asking me over and over, did it work? Did it work? And I had to say, no, not this time. It's painful. 2, I didn't want the partners to assume that I would keep repeating IVF endlessly and that would distract me from my work. That could make them rethink wanting to make me partner. 3, I didn't want the staff to feel like I was playing injured or that I wasn't operating at 100%. But in reality, work was my safe place where I could shut out the chaos and loneliness that was happening at home. It was my safe space where I could just say, I'm Dr. Khan. And 4, I was embarrassed. Surgeons don't like to admit vulnerability or weakness. Nothing is supposed to slow us down. But as the IVF process continued, I started coming late for clinic, rearranging my call and surgery schedule without an explanation. And I started to run the risk that the partners would think that I didn't take my job seriously. And as we all know, medicine is a team sport. From the front desk to the technicians and the doctors, we all have to work in lockstep in order for a smooth clinic day. Any small change in my schedule or performance affects their schedule. And my IVF was beginning to impact their schedule. But because no one knew what was going on, they could interpret my actions as being cold or diva-like, and that could cause friction and resentment between us. So at that point, I decided that sharing what I was going through would give the partners and my patients a reason for my behavior. And once I did talk about it, I was pleasantly surprised by their reactions. The partners and my people, my team, were so vocal in reassuring me that I was supported and that this was just an unusual temporary circumstance that I had no control over and that they could adjust to help me. I could clearly see the narrative in their eyes switch from, she's behaving very oddly, to, she's going through something. How do we help her? A prime example of this is one day I told my office manager, hey, listen, I'm waiting to hear back from my infertility doctor because I think my most recent transfer failed and he needs to do a confirmation ultrasound. Without even thinking or me saying anything, she moved my patients through my lunch hour. She lightened the load so I could leave in the afternoon without any qualms or hesitations. It was a small act, but a huge burden lifted from my shoulders. My team, they all rallied around me, and that experience made me fiercely loyal to my practice. I now want to support them the way they supported me. And that has paid off for the practice as well, because post-IVF, I'm now a partner in my practice, and I'm one of the most productive partners of my 16-physician multi-specialty group. I handled the largest patient and surgical volume out of anyone last year. The other problem I had was that my patients didn't know. Let me tell you, a patient that has been waiting for 4 months to see a glaucoma specialist does not react super kindly to a last-minute rescheduling or cancellation. That patient could feel like I'm not making him my priority, and I didn't respect their time and question my professionalism. Like, who is this doctor? Does she even care about me? So I started doing this really uncomfortable thing of telling my patients. And a little disclaimer, I'm not saying everyone has to do that. That's just what worked for me and my journey. But again, to my surprise, I was so impressed about how understanding they were in shifts in scheduling because they knew I was going through a difficult time. They would even share their own infertility challenges or those of their children. And it allowed me to build a level of connection with them that I had never had before. One of my regular glaucoma patients, an elderly Asian woman, she came in for her regular 3 to 4 month follow-up. And at the end of the visit, she said, "Dr. Khan, can I speak to you in private?" She asked my scribe to leave. And she said, "I brought you this black stone." And she explained to me that her cousin was having trouble having a baby. And so she put that black stone under her pillow and bada bing, bada boom, she was pregnant. And so I accepted that stone with deep gratitude and major skepticism. But at the time, I had gone through my second round of IVF that had failed. And so I was desperate enough to totally abandon medical science, dabble in this magical treatment, embrace a little Far East shaman medicine, and hocus pocus this baby into existence. I took that black stone and I put it right under my pillow. It worked. 9 months later, it worked. 3 rounds of IVF later, it worked. We got pregnant. The black stone delivered. Now, obviously I'm being facetious. Whether it worked or not, we'll never know. But the stone serves as a physical reminder to me that by opening up to my patients in my practice, that made them more understanding. And it unburdened a lot of stress from me. Telling my patients humanized me for them. It made them trust me more, and it built a stronger connection with them. I think it ultimately made me a better doctor and able to provide them with better care. So here's the thing. You are all now aware of how prevalent this is among our colleagues. My story might sound unique, but it is not. Remember those numbers. 1 in 3 young women surgeons experience infertility. That doesn't even include our male colleagues and their partners. I'm here to challenge you to all create an open and safe space for your colleagues, should they choose to disclose. Because at the end of the day, we are all rummaging through our own dumpster. Sometimes you're gonna hit a sharp object or you're gonna skin a knee. But if you, as the managing partner or the chairman of your practice, if you can bring the Band-Aids, then we will all come out of this together stronger. Thank you.